A 33 years old female admitted for varicose vein surgery. She is fit and well. After procedure, she persistently bleeding. She is known to have menorrhagia. Investigation shows prolonged bleeding time. That means there is bleeding time prolonged and increase APTT. APTT also increase, but she has normal prothrombin time, normal platelet count. What is the most likely cause? Here the options are antiphospholipid syndrome, hemophilia, factor 5 deficiency, von Willebrand disease, protein C and protein S deficiency. First of all, here you can see this is the platelet bleeding time. This is the first of all the bleeding time prolonged. That means there is problem with the bleeding, and this bleeding usually controlled by the platelet. Another important factor, which is the von Willebrand factor. But here we can see the platelet count is normal, so there may be abnormalities of the von Willebrand factor. So let's see the condition. First of all, here we can make a blood vessel. When there is suddenly injury to the blood vessel, then what occur? First of all, the blood vessel, it opens its extracellular matrix. So just below the endothelium, just deep to the endothelium, there is present different type of factors, as here this is the von Willebrand factor. So the von Willebrand factor, they present just behind the endothelium within the extracellular matrix. So what happen when von Willebrand factor activated, then platelet, it comes here and they are attached to the von Willebrand factor, and the bleeding is stopped by formation of the platelet plug. So it is a normal phenomenon. But what occur in case of von Willebrand deficiency? In case of von Willebrand deficiency, what will occur? There is no von Willebrand factor. Here is no von Willebrand factor. Von Willebrand factor absent from there. So what happened? Platelet comes here, and the platelet, it cannot find any foundation of the von Willebrand factor. So platelet here present all the time, but they are not able to form a platelet plug. So here we can see bleeding post-operatively, epistaxis frequently, and menorrhagia. It is indicative the primary diagnosis of the von Willebrand disease. And von Willebrand disease, it is one of the most common cause of bleeding time. But hemarthrosis is rare, because hemarthrosis occurs due to the factor 8 deficiency. And bleeding time is normal in case of hemophilia, in case of vitamin K deficiency, because it's in hemophilia there is the deficiency of the clotting factor. This is the clotting factor, such as clotting factor 8. In case of vitamin deficiency, clotting factor, which is the 2, 7, 9, 10. So these are the clotting factor, but here problem with the bleeding, not with the clotting. So as there is bleeding problem, so platelet count is normal, so most commonly it may be cause of the von Willebrand disease. At here we can see this is the prolonged bleeding time. So it is problem with the stopping of the blood. Here hemophilia, it is factor dependent. Factor 5 also factor dependent. Protein C and protein S deficiency usually work not here. And antiphospholipid antibody syndrome, it is also another type, and it has no relation with the bleeding time.